Hi,
Hi there.
I'm Dr. Maureen Schulte,
I'm Dr. Melina Dayal
and we are the physicians at STL Fertility.
and the co-founders.
And the co-founders, yes, absolutely. Cheers to that. So today we're getting together with STL moms to discuss secondary infertility.
Secondary infertility is relatively common. I would say about 20% of our patients who come through the door are experiencing secondary infertility.
Yes, and the definition of secondary infertility is a couple that has already conceived and has a child, but now is struggling to have their second child and has been trying for 6 months if you're greater than 35, or a year if you're less than 35.
And what's really interesting about secondary infertility, and you would not think that this would be the case, is that the causes of secondary infertility are exactly the same as if you never conceived at all.
Yes. So what Melina is referring to there are many causes of infertility, including female factors and male factors. So the female factors can be a fallopian tube problem. So if you had a C-section with your first child, that can actually lead to scarring of fallopian tubes, and that could be a reason that you're not conceiving.
Because if you have scarred fallopian tubes, what happens is that egg and sperm may not be able to come together and form an embryo, which is then required to get pregnant.
Yes. And then with weight changes after delivery, that can lead to ovulatory dysfunction. And so you might not actually be ovulating or releasing an egg every month, which then would lead to infertility, because obviously to get pregnant, we need to be releasing an egg that is then meets the sperm in the fallopian tube, forms an embryo or cellular baby, and that cellular baby travels from the fallopian tube to implant in the uterus.
Absolutely. And sometimes you can actually have potentially uterine factors. So after delivery, you could have a fibroid, you could have endometrial or benign growths or polyps within the uterus. If you've had a C-section, you might have scarring within the uterus as well.
Yes, and a lot more actually common now that we're seeing is something called an isthmocele from a C-section, which is a little outpouching of the uterine wall. And sometimes menstrual blood can get trapped in there and lead to abnormal spotting, which feels like an irregular period. But that can actually be linked to infertility as well, and we can catch those on ultrasounds.
Absolutely, and what's nice about those is those can be surgically repaired if needed.
Which is great.
Yeah. And then lastly, there can be male-related factors. So things can change with men. You know, men are making sperm every single day of their lives, but there could be medical conditions that could change the amount of sperm that they're making and how well they're moving.
Absolutely. And I think the take-home message is to really remember that the age-related fertility decline is real for women. And so as you're trying with your partner to conceive baby number 2 or baby number 3, whatever it may be, keep in mind that if you're over 35, you really just want to wait 6 months before seeking help. It's a 20% chance per month to conceive on your own, but after 6 months, everybody should be pregnant. So if you're not, seek help, because there's a big difference with our ovarian reserve and our ovarian quality between 35 and 40.
Absolutely. And if you're ever concerned, and even if it hasn't been 6 months, if you're kind of concerned after 2 to 3 months, we always say, you know what, be as proactive as you want to be. It doesn't hurt to be evaluated, because then at least you could be reassured and keep trying. Or maybe we'll identify a cause that we can actually treat you for.
Right, because if your fallopian tubes are blocked, it's not going to happen at home.
Right.
So you're going to need intervention, so it's better to find that out earlier.
The sooner the better.
Absolutely.
Because then we can help you.
Yeah. All right. We hope that you enjoyed us talking about secondary infertility. And so please remember to reach out to us with any questions or comments. We are always here for you. And call us at STL Fertility.
Yeah. Good luck.